Hello, my name is Dr. Nilesh Giri, consultant intervention cardiologist at Techno DAMA hospital. So today we are going to discuss among a very common topic that we encounter among cardiology patients, that is angiography and angioplasty. Many times we hear from our near ones that the patient needs to have angiography. My patient needs to undergo angioplasty. So most of the times we think that both of them are similar, but there is a basic difference between both of them. Angiography is the procedure by which we see the pictures of the arteries of the heart. We inject a dye into the ostium of the heart, and the blood gets filled up with the dye, and we see that in the background of fluoroscopy, which is basically a moving X-ray. Now we analyze those arteries and we see whether there is a specific kind of block or not. Most often the block is around 70% when we call it its major block, and it is around less than 30% we call it a minor block. Means major block needs treatment by angioplasty and minor block needs treatment by medicines only. So if the patients have a significant block, then the patient will be referred for angioplasty. So coming to the second part of the discussion, what is angioplasty? So now we will discuss about angioplasty. So what is angioplasty? Angioplasty is the procedure by which we rectify the block, and we do that in microcatheter technique and by transcatheter technique. We do not actually open up the patient's chest and like surgeons do. What we do is that we again put a catheter through our peripheral arteries, and we take that up to the base of the heart, and then we insert a very thin wire across the block, and then we inflate the block with the help of a special balloon, which is called a coronary dilatation balloon. And after that we put in a ring-like structure which is made up of specialized metals, and which integrate into the blood vessels, the wall of the blood vessels over the course of time. And by that we get the arteries as the block is gone and the flow is restored like previously. So this is angioplasty. So angiography is the diagnostic test and angioplasty is the treatment. So they cannot be used synonymously, and both of the procedures we are doing in this hospital regularly, and it's a moderately very safe procedure. Angiography has a risk of any complicating risk of only 1 in 10,000, whereas angioplasty there is a risk of around 1 in 500. So it's a very riskless procedure, and you can easily avail the services at our hospital.